Friends, Namaskar, good evening. I welcome you all for today's homeopathic awareness program. My humble pranams to all my gurus, teachers and masters. My pranams to Dr. Shastri Garu, Homoeo Garu and all my team members. Last class, that is on Thursday, we could not do it. See, I have taken, before our classes started, Geo internet connection to have better service. Even that, now and then I am facing problem. Suddenly signals problem will come. So because of the, just before starting our class, I checked the signal strength. It was very good. But when I started the class, signals have become weak. So I am helpless. I was helpless. Okay. Anyhow, without wasting time, today let us start the class. Our Dr. Pavani is going to speak to you on Kali CARB. Dr. Pavani, she did her BHMS in Bhagavan Buddha Homeopathic Medical College, Bangalore. Then after that she worked outside. Then she was recruited by MDMK Trust by Malladi Krishnamurti Garu in Bangalore, and he wanted me to train her in case taking, especially constitutional approach. So he has deputed her to our forum. So for that reason, she worked in our forum and she learned about constitutional approach, case taking, personality, all those things. She learned. She is a very intelligent girl and lot of desire to learn the things, adaptability, learning, all those things. She is intelligent in many ways. So she could able to pick up very well. Then now she joined because of various reasons. She has to move to Bombay, and from there Nellore, where our parents were there. Then our parents, because of the sickness, they have gone to Hyderabad. Now she is working in Apollo 24/7. There is a Apollo group. They are having the 24/7 medical service. In that she is working, and she was well appreciated because in recognition of her service, last Wednesday, that is Thursday class we could not do. Wednesday, she received an award from her organization, Sushruta Award from her organization for her very good service. Okay. So my blessings and good wishes to her to come up in her career and to do her higher education. With all this blessing, she is going to speak on Kali CARB. This is the title of the medicine, Kali Carbonicum. We call it as KC in short. Then this is the material, potassium carbonate. This is the material. Earlier, potassium dichromate also near to this color, that is a little dark color, and this is light color. So it looks similar. Now I invite Krishna Pavani, Dr. Krishna Pavani, to speak to you on Kali CARB.
Good evening, everybody. My name is Dr. Krishna Pavani Malladi. My humble pronouns to my parents, my lecturers, especially Dr. Madan sir, PV Satyanarayana sir, and all elders who are watching this video. I did my Bachelor of Homeopathy Medicine and Surgery from Bhagwan Buddha Homeopathic Medical College with the support of my lecturers, especially Dr. Madan sir, who is highly knowledgeable and very helpful to all students, not only to me, to all students, irrespective of any timings. And coming to my journey with HSRF, I would like to tell a special thanks to Malladi Krishnamurti sir. Because of him, I came to know about PV Satyanarayana sir. I worked in MDMC Trust. As a part of a training in MDMC Trust, I've joined in HSRF and I met PV Satyanarayana sir. PV Satyanarayana sir is highly knowledgeable person, especially constitution medicine. Like his passion about homeopathy. That's why he's very deep into the subject and in constitutions. Many of the person doesn't know about the constitutions, especially during college times. Like even I have faced the same issue during my college time. I used to think like which person is which constitution. I used to have lots of confusion. I hope many of the homeopaths who are watching this video, even they have faced the same issue during their college days and all. Because with the help of PV Satyanarayana sir, now I can able to identify which person which constitution. That is just because of PV Satyanarayana sir, because the way he explains the constitution is completely different and it is very easy and anybody can understand. Thank you so much, PV Satyanarayana sir, for accepting me as your student and polished me in constitution medicine. And I'm really, really thankful to you, sir, and I'm blessed to be your student. You're more than my father, sir, and you have treated me as same. So, today I'm going to explain about Kali Kar personality. So, prior to that, I'll be telling about what is Kali group and what and all the medicines that are there in Kali group and some of the features of the Kali group, common features, and more about the Kalika personality, physicals as well as the mentals. Kali group. Kali group is nothing but the potassium group. I think many of you people knows about the potassium, right? So many of the people who undergoes these investigations, if you see electrolyte profile, there you can see the potassium also. So what will happen if you are having less potassium? What and all the symptoms you will be having, like fatigue, weakness, tiredness, and lethargy, muscular pains, irregular heartbeats. So these kind of symptoms are noticed in the people where they are having less potassium levels. So similarly, high potassium levels also be seen in some cases, such as in diabetic patients, kidney patients, and heart complaints. So in these cases, we can see even high potassium levels. So the low potassium levels, hypokalemia, and the high potassium levels, hyperkalemia, both are not safe for our body. So it should be a balanced state. So now, what and all the symptoms I have said, like for the low potassium levels, lethargy, fatigue, muscular weakness, irregular heartbeats, so exhaustion. So these symptoms and all will be there in Kali group also because potassium only. So Kali is nothing but the potassium. So the other name of Kali is potassium, derived from potash, obtained from wood ashes and remains of burnt vegetable matter. So it is an alkaline substance. Its great affinity for water makes it attack the tissues with great eagerness, producing very deep excoriating effects. So it has been determined by many experiments on animals that potash, particularly the carbonates, acts by paralyzing the muscles. So this accounts for general weakness, which belongs to Kali preparations. And with this, we find Kali salts are used in great muscular weakness, exhaustion, and accompany convalescence from prolonged diseases. So here you'll come to know like this muscular weakness, exhaustion, and this accompany convalescence from prolonged diseases. So as I said, if you are having a low potassium levels, then you will be having these symptoms only: muscular weakness, exhaustion, so muscle cramps, edemas, these kind of symptoms and all will be seen low potassium levels. So coming to the characteristic feature of Kali group, Kali group are very built, heavy built, stout and robust. They're like hefty personalities. All Kali remedies are prone to gain weight, have premature old look and black rings around the eyes. So, even though if they're 30 years of age, but still they look 40 years of age. Not only because of their well built personalities, hefty personalities, because of their poor dressing sense too. They will be like old fashioned kind. So, that I'll be explain in detail next. So all Kalis except Kali self are chilly, very sensitive to cold air and aversion to cold air, better by warmth. So all Kali personalities except Kali self are chilly in nature. So almost all Kalis have rheumatic and gouty tendency. So this will be like muscular related issues. It will deal more about the muscular related issues. So antisyphilitic, slow onset and slow decline of diseases. So most of the Kali remedies mainly act on tissues, muscles, especially heart, nerves, especially vagus nerve, gastrointestinal tract, skin, hair, mucous membranes, glands, bones, and respiratory systems. So it deals more with joints, tendons, and all. So it is antisyphilitic, slow onset, and slow decline of diseases. Most of the Kali remedies mainly act on tissues, muscles, especially heart, nerves, especially vagus nerve, gastrointestinal tract, skin, hair, mucous membranes, glands, bones, and respiratory system. So, coming to the main characteristic mental symptoms. So, the most important characteristic of Kali group people is that they are very conscientious. They are people with the strong principles. They have their rules and norms and they stick to them. They are very reliable, correct, stable, self assured. They have a great sense of duty. They are serious and responsible. In the course of time, however, this can go too far and the negative side may start to come up, like being rigid, inflexible, moralistic, conservative, and indifferent. So, in order to live according to their principles, they control their emotions and other aspects of their life. They prefer routine to new and unexpected things. Playful and artistic traits are hardly acknowledged. So that is why they seem to be materialistic, but they are more practical and down to earth than egoistic. So when we speak about these people are with strong principles and they stick to their duties. They are also fault finding and quarrelsome, anxious all the time, but most marked in the morning on walking, anxious about future, salvation, and disease. Has full of fears: fear of going to bed at night, fear of crowds, fear of bad news, and fear of being alone. So, irritability and stubbornness marked at night, after coition, during headache, and during menses. So, weakness of memory, cannot remember events, concentration power is less. And Kali personalities, they are indifferent to everything. So, to pleasure, to business matters, and then becomes lethargic and tiredness. So their sense of duty is expressed in their task. Perhaps task is even better theme of the Kalis than duty. So they are very task conscious. They are very hard workers, able people, and builders of the society. They are very practical. They work hard and steadily. Although they do not overdo it, they are not real workaholics. They have a sort of fatherly aura. So, professions in which they thrive are managers, policemen, judges, translators, and bookkeepers, etc. Overall, as I explained, they stick to the principles, quarrelsome, anxiety. So these are rigid, inflexibility. These are very peculiar traits of the Kali personality. For example, Kali personality people usually they'll get up as usually they'll get up at morning 6 o'clock. They'll get ready by 7 o'clock. They'll go to the office by 8 o'clock. They'll finish their work, what and all they assigned to them. Not even the risky work or extra works. Only the assigned work. They'll finish that and again they'll come back to their home and they'll do their work and again they'll sleep. So such type of systemic ways, these things will be seen in Kali personalities. They are very rigid. As I said, fault finding and quarrelsome. So this quarreling nature is very peculiar in Kali personality. So, for example, they'll keep on quarreling with the doctor, but still they'll go to the same doctor. Even that we can see in the Kali personality. And anxiety, coming to the anxiety, even if they're anxious, but they will not show to others they're anxious, like other like our salb and all, we can come to know about their anxiety, but that Kali personality people, they will not express that, even though if they're anxious. Some of the Kali remedies that we are using in our day-to-day practice are Kali aceticum, Kali ars, Kali bike, Kali bromatum, Kali cynatum, Kali carb, Kali carbonicum, then Kali floretum, Kali iodatum, Kali mure, Kali muraticum, uh, Kali phos, Kali sulf. So nowadays 42 Kali remedies are there. In this, only these are majority wise we'll be using in our day-to-day practice. So let's go with the Kali Carbonicum, Kali Car personality. So the keynotes are rigidity, conventionality, and anxiety. So these things are main things. So rigidity, Kali Carb is far the most commonly occurring Kali form, a constitutional point of view. The only other one which is seen with some frequency is Kali Bike. So only these two will be having somewhat similar features of personalities. So being distinguishable mainly on grounds other than the mental. So Kent remarks on his lecture notes that the Kali card patient is a hard patient to study, and that remedy is not used as often as it should be. So Kali is a closed type, and hence it is hard for a homeopath to get sufficient information about the personality to get a grip on it. So most of the Kali mental characteristics can be understood as a manifestations of the essence of the type, which is rigidity. As I said, rigidity is very important. The first impression one gets of a Kali card person is a certain formality, a stiffness that reveals a lack of relaxation of body and mind. This can be seen most clearly at parties and nightclubs. Even Kali gait in the sense the walking style, so tends to be rather stiff. So by by looking at their walking style also, that stiffness while walking also, we can come to know that they are Kalika personality. So conventionality, Kali people come across as responsible, serious and conventional. They find it difficult to have fun because always much concerned with doing the right thing. Kalis are the most conventional on all types of all types. They resist the change to unprove and the unfamiliar. So one of the most characteristic way they do is sticking to the book. So a Kalika employee will stick to the exact details of his job description, carrying out his duties as regularly as a clockwork and never sticking neck out by doing something risky or unfamiliar. So, what and all it is there in his job profile during the joining time? Suppose these things and all you need to work, these are the roles that you need to do. What and all they mentioned in his job profile, only that he will be doing. Extra risky work or extra unfamiliar things, he will not at all look or touch those things. So this can be seen most clearly in civil servants, bureaucrats, and others in position of authority. So you can see even military people also. The Kali clerk will never bend the rules. It is more than his job is worth. So, on the other hand, Kalis are very susceptible to public opinion and to any threats to their own position. So, hence could be coerced into secretly breaking the rules. So, Kali politicians, for example, would have to do secret deals like other politicians to remain in power. So, Kali's mental rigidity leads to an inability or unwillingness to adopt general rules to specific circumstances. For example, a Kali policeman may look a motorist for parking illegally. So, even though the motorist had a pulled over because his engine had cut out, he does not do this out of malice, but rather because the law is the law and he dare not to be flexible in interpreting it, mainly because he is afraid of getting into trouble. So Kalis try to avoid trouble by sticking to tried and tested formulae, be they written laws of the land, religious codes, professional protocols, or the values handed down by his forebears. See, as I explained in this example, so the policeman knows that just because of the motorcycle engine breakout, he was going a wrong way, or he parked in an no parking area. He knows just because of that he parked there, but still uh, you should not park in no parking area. So that is the rule or law. So the policeman, Kalika personality policeman, so he will stick to the law irrespective of what happened. So that is because of his afraid of getting into the trouble. So the Kalika personality will be having that afraid that he may get into the trouble. So that's why he'll stick to the laws also. And also some values handed down by the forebearers in the sense, see, like some of the religious things will be there, forefathers and all will be doing, and even he will be also continuing the same thing, same that rituals or whatever it may be, with very strict and following the same rules and regulations without changing anything. And he'll be expecting the same that should be done even his children also. So such type of rigidity or inflexibility, materialistic, seen in Kalika personality. So, Kali's attachment to clearly defined rules and regulations is similar to that seen in Ars individuals. But there are subtle differences. Arsenicum generally has a stronger ego than Kali. So, as I said, Kali people will be less egoistic, but they're more quarrelsome nature. So and can so these Ars people are having the stronger ego than Kali, and can be seen to pursue his principle of conscientiousness and property with zeal. Kali, on the other hand, is usually less confident and sticks to the rules more out of self protection than out of strongly held conviction. So, as I said, he will stick to the rules because he's afraid of getting into the trouble. So that's why he's making the self protection. Arsenicum tends to be passionate and determined about his love of order, whereas Kali is sensible, logical, um, and quiet about his principles. So both types tend to seek social approval, but arsenicum tends to do it with more style, whilst Kali tends to appear grey and anonymous and more concerned with doing what is acceptable than with impressing people. So grey and anonymous in the sense, it is like, say, Kali people are not that much concerned about their dressing sense also, as I explained earlier. So Kali people will look premature look. They'll be having the premature look, not only because of their hefty personality, because of their dressing style also. They will not impress others by wearing good dresses and all. They'll be like old fashioned kind. So all normal kind, old fashioned, old normal kind of clothings they used to wear. They will not concentrate much on their looks also, whereas the arsenicum people will be very perfect even in the uh, how they wear the dresses also, irrespective of everything. So next is insecurity. So Kali's insecurity is very similar to that of arsenicum, being focused primarily on the material plane and manifesting as a fear of illness, poverty, and loss of social favor like arsenicum. So Kali is generally careful with money. He's also likely to treat his body moderately rather than going to the fanatical degrees of health consciousness seen in some arsenicum individuals. So arsenicum people will be having anxiety about their health. So they'll keep on worried about their health, and they'll keep on going for hospitals for checkups, or they'll spend money on their health. So they'll give more concentration to their body and health, whereas the Kali people, they'll treat their body. They will not spend that much on their health or body. They're moderately. So indeed, many Kalis live a very sedate existence, which is routine bound and lacking in both exercise and dietary variety. So if you see scientifically also, if you sit if you live a sedentary life, if you sit without any exercises because of lacking of both exercises and because of poor diet, obviously you will gain weight. So when you see the physical constitution, we said like a hefty personality, overweight, overgained weight. So why you'll be gaining the weight? Because of this, mentally you will be like um, uh, sedate existence, and you'll be lacking in both exercises and also the dietary variety. Because of the poor diet and because of the lack of exercises, obviously you'll be gaining the weight. So it is like a connection between the mental as well as the physical. So coming to the anxiety, like several other rational types, Kali people are generally very reluctant to admit to their weakness. So they will often deny all fears and worries during the consultation, or will pay them down as much as possible. So as I said earlier, um, they will not admit their weakness. Kali people are like a very closed people. it is very hard to get a Kali personality. Maybe we will be getting in a day-to-day practice, but it is very hard to identify that they are Kali personality, because they're a close type. They will not express everything, uh, a few things thoroughly, even their anxiety also. So some of the multiple uses of Kali card. Before going for the multiple uses of Kali card, I just want to give one example or one character which is suiting to the Kalika personality. I hope many of you knows about Aparichitudu movie, right? So if you see that, if you didn't see Aparichitudu movie, you can go and watch. Then if you see in that movie, there are of course three different variants are there because of his mental condition, but the original variant is Ramanujan. His main name is Rules Ramanujan. So this person also, he'll get up daily in the morning. He'll do his rituals. He'll go to his work court. He's an advocate, so he'll go to his work on time. He'll do all his works, and again he'll come back to his place. So the systematic sticking to the rules, you can see in one scene, like some brake wire, if it got damaged, then he'll go to the court and he'll put some case on that company because of the because of not following the proper rules and regulations of making the brake wire or something is there. So he is very much sticking to the rules. That's why his character name was Rules Ramanujan. So similarly, Kalika personality also same like that only. And even he's like he'll be like old fashioned person. So that's why heroine also doesn't like him initially, because he'll be old fashioned, always religious kind, follows the old traditions as it is. Than being impressive. So Kali personalities are not impressive. So that's why heroine also will not like this Rules Ramanujan. So these kind of traits, what I said, rigidity, the gait, how he walks, if you see, after giving the love letter to heroine's parents, while he's walking, you can see the rigidity of his walking, the style. So everything matches to that rigidity, anxiety, or rules and regulations, sticking to the rules and regulations, and not expressive, not good in dressing, old fashioned, following the rituals as it is. So these things and all will be seen in this same character. So I feel that Kalika personality is somewhat similar to Rules Ramanujan. If anybody didn't see the movie, then you just watch it once again. Then you'll come to know whether it is matching or not. Okay. So coming to the multiple uses of Kalika, weakness characteristic of all potassium salts is seen especially in this, with soft pulse, coldness, general depression, and very characteristic stitches, which may be felt in any part of the body or in connection with any affection. So, all Kali pains are sharp and cutting, nearly all better by motion. So, never use any salts of potash where there is fever, like sensitive to every atmospheric change and intolerance of cold weather. One of the best remedies was severe weakness and other effects following labor or miscarriage. So this is very peculiar thing. Early morning aggravation is very characteristic for fleshy aged people with dropsical and paralytic tendencies. So usually if you see this low potassium levels also, we can see in the old age people also. And if you take 10 cases who are having low potassium values, if you just take and just do some normal research, and many people who are having those low potassium levels will be hefty, fleshy kind people, will be like weak and dull kind. Even though if they're 60 years, they look like 75 years old. So such type of Kali personalities we can see. Physical constitution we can see. So out of 10 who are having low potassium levels, hypokalemia, low potassium we'll be calling as hypokalemia. So this constitution we can match it off. So for fleshy aged people with dropsical and paralytic tendencies, sweat, backache and weakness is also a marked symptoms. Throbbing pains, tendency to dropsy, tubercular tendency, pains from within outward, and stringing character. So giving out sensation, fatty degenerations, stinging pains in muscles and internal parts, twitching of the muscles, pain in small spot on left side hypothyroidism. I mean, pain in a small spot on left side affinity, and in hypothyroidism cases, and even in the coccytis, in the sense inflammation of the hip joint. So these cases also we can give. So generally mind, as I said, despondent, alternating moods, very irritable, full of fear and imaginations, anxiety felt in stomach, sensation as if bed were sinking. So this is one of the important symptom. Never wants to be left alone, never quiet or contented, obstinate and hypersensitive to pain, nose, hypersensitive to pain, nose and touch. So coming to the head, vertigo and turning, headache from riding in cold wind, headache comes on with yawning. So some people will keep on yawning. Simply, sometimes even everybody can experience. You'll be thinking like, why we are yawning continuously. So few people after yawning, they'll be getting this headache, and this is one of the main symptom for this Kali carb. Stitches in temples. Temples is this region. Aching in occipital. Occipital is backside. One side with nausea on riding in carriage. So loose feeling in head. Great dryness of hair falls out, similar to acid floor. So coming to the eyes, stitches in eyes, spots, gauze and black points before eyes. If you close the eyes or if you open the eyes, some black spots, you can find it. So that is the one of the symptom in this Kalika. Lids stick together in morning. So as we know, morning time aggravation. So this is also one of the symptom, morning time. So lids stick together in morning, swelling over upper lid like little bags, swelling of glabella. This is the region, glabella, between the brows. Uh, Poor eyesight, asthenopia, weak sight from excessive sexual indulgence, and on shutting eyes, painful sensation of light penetrating the brain. So coming to the ears, stitches in ears, itching, cracking, ringing, and roaring. So nose stiffs up in warm room, thick, fluent yellow discharges, post nasal dripping, that is inside. So sore, scurfy nostrils, bloody nasal mucus, crusty nasal openings, nose bleeds on washing face in morning. So even this you can remember, ulcerated nostrils. So coming to the mouth, gums separate from teeth, pus oozes out, and pyorrhea, apta ulcers, tongue white, much saliva, constantly in mouth. So some people will be telling like, continuously I'm getting the saliva in mouth. I should keep on spitting it out. So even this you can think. Kalikarb also, if other symptoms, other modality matches, then you can think Kalikarb. And bad slimy taste. So coming to the throat, dry, parched, rough, sticking pain as from a fish bone, swallowing difficult, food goes down, esophagus slowly, mucus accumulation in the morning, stomach, coming to the stomach, flatulence, desire for sweets, feeling of lump in pit of the stomach, and gagging, dyspepsia of old people, burning acidity, bloating. So there will be a difficulty in swallowing. So in old people also, bloating sensation, burning acidity, all gastric complaints. So gastric disorders from ice water. Even this you need to, all complaints are aggravated because kali carb is chilly. So majority of the complaints will be aggravated because of cold related things. So sore erectations, nausea, better lying down, constant feeling as if stomach were full of water. So sore vomiting, throbbing and cutting in stomach, disgust for food, anxiety felt in stomach, epigastrium, sensitive externally, easy choking when eating, epigastric pain to back. So epigastric, in the sense, so this center of your upper portion of your stomach. See, usually abdomen will be divided as portions. So epigastric is the center part, upper center part. So that is the epigastric region. So if the pain is going from this center part of the upper part of the stomach to the back, and even you can think this Kalika remedy. So abdomen, stitches in region of liver, old chronic liver troubles with soreness, jaundice with dropsy, distension and coldness of abdomen, pain from left hypochondrium through abdomen. So as I said, center part is epigastrium, upper center part is epigastrium, left hypochondrium is the left side of that upper part of the abdomen. So this is called the left hypochondrium. So pain from the left hypochondrium through abdomen, must turn on right side before he can rise. So he should turn right side, then he should get up. So coming to the rectum, large difficult stools with stitching pain an hour before, hemorrhoids, large swollen, painful, itching, ulcerated pimples around the anus. So even this you can think, one of the important symptom. Large discharge of blood with natural stool, pain in hemorrhoids when coughing, burning in rectum and anus, easy prolapses. So coming to the urine part, oblique to rise several times at night to urinate, pressure on bladder long before urine comes. So before coming urine, he'll feel much pressure in the bladder. So involuntary urination when coughing, sneezing, etc. So this involuntary urination you can see even in causticum too. So coming to the male, complaints from coition, deficient sexual instinct, excessive emission, followed by weakness. So coming to the female, symptoms, menses early, profuse, too late, pale and scanty, with soreness about the genitals, pains from back down through gluteal muscles. Gluteal muscles are your buttocks, but where you will be having, with cutting in abdomen, delayed menses in young girls, with the chest symptoms or ascites. Ascites is nothing but accumulation of fluid in your abdomen. So difficult first menses, severe weakness and other problems following labor or miscarriage. So bleeding from uterus, constant oozing after copious flow, with a violent backache relieved by sitting and pressure. So coming to the respiratory symptoms, cutting pain in chest, worse lying on right side. So hoarseness and loss of voice, Dry heart cough about 3 a.m. This is also one of the main modality, like 3 a.m. heart cough about 3 a.m. with the stitching pains and dryness of pharynx, bronchitis. Whole chest is very sensitive. Expectoration scanty and tenacious. So even though if you try to expectorate, the phlegm will not be coming, it will be very less, but increasing in morning and after eating. So say as the time passes, like after 3 a.m., like 6 a.m., 7 a.m., 8 a.m., and after eating, then it will be increasing. So aggravated right lower chest and lying on the painful side. So hydrothorax, one of the lung condition. Leaning forward relieves chest symptoms. So if you lean forward like this, then the chest complaints, you feel better. Either this whatever the heaviness in the chest, or sometimes breathing difficulty also. So expectorations must be swallowed, cheesy taste, copious, offensive, lump, coldness of chest, wheezing, and cough with relaxed ovula. Ovula is like there inside your back of your tongue. You'll be having that. So tendency to tuberculosis, constant cold taking better in warm climate. So coming to the heart, sensation as if heart were suspended, palpitation and burning in heart region, weak, rapid pulse, intermits due to digestive disturbances, threatened heart failure. So coming to the back, great exhaustion, stitches in region of kidney and also right scapula. A small of back feels weak, stiffness and paralytic feeling in back, burning in spine, severe backache during pregnancy and after miscarriage, and also the hip disease. Initially, only I have mentioned, like even in the hypothyroidism, and also the coccytis, inflammation of the hip joint. So there also we can give pain in nates and thighs and hip joint. Lumbago with a sudden sharp pains extending up and down and to the thighs. Extremities, backs and legs give out uneasiness and heaviness and tearing in limbs and jerking kind of pains, tearing pain in limbs with the swelling and limbs sensitive to pressure, and by white swelling of knee, tearing in arms from shoulder to wrist, lacerating in wrist joint, paralysis of old people, and dropsical affections. Limbs go to sleep easily. So tips of toes and fingers are very fingers are very painful. Toes and fingers. Soles were sensitive and itching of great toe with pain. Pain from hip to knee. Pain in knee. So as we see, it is like a rheumatic and gouty diathesis. So it is more peculiarly we can give for this extremities, back and extremities. So for this joints, tendons, and we can give joint pains and all also we can give. So coming to the skin, if uh, burning as from a mustard plaster, and sleep drowsy after eating. So majority of the people will be having this and can think like, oh, so after eating I'm feeling drowsy, means then I should take kali carb. You should not take like that. If everything matches, then only please take. Wakes about 2 o'clock and cannot sleep again. So modalities, worst after coition in cold weather from soup and coffee in more about 3 o'clock. So the chest complaints also you can see that the complaints are more at 3 o'clock, 3 a.m. and lying on the left and on painful side. Better in warm weather, though moist during day and while moving out. So when you see the relationship, it is complementary to carbo-veg, the gastric complaints and all. So lowness of vitality may suggest a preliminary course of carbo. Nasab, then we can think about the kali carb also. So and also it follows up the nuts, often in stomach and bladder troubles. So the antidotes are camphora and coffea. So dosages usually we can give the 30th and higher doses. Do not repeat too often. So use cautiously in old gouty cases, advanced kidney diseases and TB. So if you see this, initially when I start about this Kali group, I said about the increased potassium levels. So what will happen if there is an increased potassium levels, and in what cases we can see? I explained in kidney cases, in diabetic patients, and some in Addison's disease, and one heart complaint. So in these cases, already people are having these problems, and if you keep on giving the high dosages, um, irrespective of matching the symptoms or not, then it will still more worse the problem, especially the kidney related problem. So people who are having the kidney related diseases, CKDs, chronic kidney failure, or anybody, they'll keep on monitoring their uh, electrolyte profile. So that time, if the potassium levels are more, then it is not a good sign. So that's why use a 30th and higher wherever it is required, and whenever it is required, please repeat it. But don't do it too frequently. So you should keep in your mind, like hypokalemia, low potassium levels also, it is not good for health, and also the high potassium levels also not good for the health. So this is about the Kali group personalities, Kali group features and Kali card personality. So I hope you understood a bit about the Kali card personality. So the main points are like rigidity, insecurity, anxiety, quarrelsome nature. So arguments they'll do. So these things they'll stick to the rules and regulations, materialistic. So these points just keep in your mind. So as soon as if you see the person, then you'll get an idea like he is somewhat similar to Kalika. So after taking the complete history only, we'll come to know whether he is Kalikarp or some other personality, because it is somewhat similar to Arsenicum also. Even Arsenicum people also, they are very strict at their rules, and they're strict to rules and regulations, punctual, and even they do care about the money. They'll save money. When Kali people also save money. So, but there are some differences. Arsenic album, ours all people are very fast at doing works. They're quick grasping in nature, whereas Kali personalities are hardworking. They're a bit slow in doing works, slow in onset, and even as I said, they're hardworking. So, and Arsa people are Kali personalities are not that much egoistic, and ours are people usually they'll give importance to their external appearances, as well as they're anxious about their health. They'll spend money and to their body for health. They are more worried about their health, whereas the Kali personality, they will not give that much importance to their looks. They'll just wear the old fashioned normal gray and anonymous kind of clothes. They'll just wear. They will not give that much importance to their looks, and they treat their body moderately. So these are the differences. We can just rule it out whether his Arsenicum album or Kalikar. Just because he's chilly, ours also chilly, and Kalikarp also chilly. Ours people also will do arguments. Kali people also will do arguments. Ours people also will stick to the rules and regulations. Kali people also will stick to the rules and regulations. So don't mix the both. So when you compare these things, then you'll come to an idea, you'll get an idea like whether they're ours or Kalika personality. So this is about the Kali car personality. I hope everyone understood this. And thank you so much, PV Satyanarayana sir, for giving me this great opportunity. And I'm still a student of you and I'm still learning from you. And thank you so much for everyone. Before ending this session, I just want to tell a few points. Like in my practice, few of the patients are see when we are giving prescription, like no homeopath will give the prescription except PV Satyanarayana sir, and who follows PV Satyanarayana sir. We are giving prescriptions. So when we are giving prescription, kindly please don't see in Google. It's my humble request. Please don't see the medicines in Google. You will not understand. So, homeopathy is a vast. So, just by seeing this symptom, yes, it is matching to me. So, I am this personality. Don't do like that. So, there is a lot to learn, a lot to match everything. Based on that, we'll give the medicine. So if you see the Google, then you'll get some other things. So that is not a good thing. So my humble request, please don't see medicines when we are giving the prescription. Just trust us and take the medicines. You will be all right, but don't Google it. You will not get the correct thing, because it is not like allopathy. Like paracetamol is for fever, like that it will not be there. So homeopathy, one medicine we can give for different problems based on the modalities, everything. That if you study homeopathy completely and if you are into the homeopathy, then only you will come to know. Simply by just seeing or googling, then you will not come to know. And also by just by having the symptom, okay, this symptom is peculiar. So doctor said, or PV Satyanarayana sir said this symptom is very peculiar in this medicine. I mean, in this example, the Kali card, one peculiar symptom I said. Only with that, only if that symptom is there, don't think that I am this group, I am this constitution. There are few things which we need to match it out. So, based on that, we'll come to an idea which constitution you are. But many of the people are just they're saying only one symptom and they're telling no, 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 I'm not this constitution, that constitution. So, it's my humble request. Please don't do like this. Learn homeopathy and you'll come to know what is what, but don't Google it. Thank you so much. Good night.
So, thank you, Krishna Pavani, Dr. Krishna Pavani, for your nice presentation. So, my blessings and good wishes to you to grow in your career and to become a excellent homeo doctor. Then, friends, Krishna Pavani is daughter of Malladi Satyanarayana garu and Vatsalya garu. Her mother's name is Vatsalya, father's name is Malladi Satyanarayana. Okay. And her brother is settled in USA, and mostly Miss Krishna Pavani, Dr. Krishna Pavani also will be going to US and doing for higher studies. She has got certain plans to do higher studies in USA, and most probably she may be settling there. So that's what. Then thank you once again, Dr. Krishna Pavani. Here about Kali CARB, most of the points she covered very nicely. This Kali CARB, coming to the regular uses during pregnancy, is a wonderful medicine. Many women, they get back pain during pregnancy or even after miscarriage. They will have severe back pain. So that back pain during any stage of pregnancy, when women complains about back pain and Rostox is not helping, Calicarb is a wonderful medicine. Calicarb helps a lot. So many women where Rostox has not helped, This CARB has helped. Okay. Then another thing is, in asthmatic complaints, the modalities, patient feels comfortable when severe asthma, wheezing, breathing difficulty is there, wheezing is there. At that time, patient feels comfortable by bending forward, suppose sitting in a chair and putting a pillow on the table and lying down like this, support, bending forward, lying down like this on the pillow, the person feels comfortable, and warm drinks gives comfort, and fan should, all the windows should be closed, everything, room should be warm, but at the same time during the attack, fan should rotate at a slow speed, because otherwise she sweats more during that attack. So fan air should be there, but not cool breeze from outside. So cool breeze from outside they cannot. They Holikar people are very chilly. Chilly people like Hepar Sulf, that from the door gaps, window gaps, that openings, small gaps, air should not come. Similarly, Holikar people also should not get cold air. Okay, yeah, fan should rotate, and they should bend forward on a pillow, keeping on the table like this, they support, or like this, they will be supporting forward. So there they feel comfortable. So on that basis, also for acute condition, Kalikarb helps very well. When chronic condition, you have to consider all the factors to treat. Okay. Then I will give you here another remedy with similar symptom, that is China horse. China horse also bending forward is comfortable, but in case of China horse, patients should sit by the side of a open window. Cool breeze should come from outside, whereas Kalikarb, cool breeze should not come. Then open window is comfortable, or even open door should be open, air should come from outside. So, and bending forward, Kalikarb also bending forward on a pillow, and China horse also bending forward. Both China horse and Kalikarb better by warm drinks. Everything is same, but in case of China horse, cool breeze from outside it should come. In case of Kali horse, Kalikarb, cool breeze should not come, but fan should rotate. Otherwise, they sweat more. So these are all the modalities. Okay, important modalities. And other day, Hanume Garu spoke very well about modalities. So here the modality is differentiating. What is the importance of modality? Here we can apply. China horse better by cool breeze, and Kalikarb better by warm room. And when the sweating is there, fan should rotate. Otherwise, fan air also not required. So these are the different modal two drugs, and based on this, I have treated number of cases, asthmatic cases for acute condition. Whenever acute condition is there, China horse gives lot of comfort, warm drinks gives relief, and fresh air gives relief. Whereas Kalikarb, warm drinks gives relief, and closed room feels comfortable. But both are bending forward comfortable. Okay. Then in case of Kalikarb, there will be dropsical conditions. These eyelids, upper eyelids, like bags, they will be hanging like bags. Okay. That is another important symptom in Kalikarb. Then Kalikar people are in general very chilly people. severe backache during pregnancy. I already told you, hip disease. Then she has covered many points. Apart from these things, I want to tell you something extra. What is told by our doctor, great homeopath, our Dr. Rajan Shankaran. He has mentioned in his book, Soul of Remedies. He has written very nicely about Kali CARB. Kali CARB patients are very quarrelsome. With whom they are quarrelsome? Not with outsiders. They are with own people, their own family members, and with their own bread and butter. They'll fight. They expect a lot of attention from the family members, lot of support, attention, but that is not there. They become quarrelsome. They are disgusted. They develop disgust, hatred, sulky, and repulsive, and quarrelsome, argumentative. Okay. See, Dr. Rajan Shankaran says this. They are afraid of being alone, fear of being alone, desire for company, and tremendous anxiety, want to be being with the group. Kali CARB always want to be with group. So they want to be with group or with the family. And her entire life, if there is a Kali CARB lady, entire life revolves around her family. And no, she is always worried about family. If any family member becomes sick, all her sickness will come, and she will get into sickness, and she will become, she will develop a lot of anxiety, tremendous anxiety. Because of that anxiety, she will develop sickness. Her problems will be aggravated when any of her family member becomes sick. Okay. Dependence on the group of our family is so great. Her entire life revolves around her family. The health of family members, the integrity and her family, the amount of support she gets from her family, etc. She becomes very anxious if her child falls sick or child does not do well in his examination. She will become totally disturbed or perturbed, and all her health problems will get aggravated. If suppose she is asthmatic patient, she will get asthma attack. If her child has not done exam properly, her child becomes sick. So you can understand the anxiety even much more than arsenic valve. Okay. When she feels that her husband is not supporting her enough, she becomes irritable, quarrelsome, nagging, which is expressed as shirking, as trifles. Dreams of dead relatives. They get dreams of dead relatives, and she, as if they are quarreling with her. The dead relatives are quarreling with her. Okay. And one big aggravating factor is Kali CARB would be the sickness in any member of family, especially supporting one, becomes, they are absent, they are not there. She feels forsaken when she does not get support she needs. Then they can be very irritable, angry, quarrelsome, dreams of quarreling with dead relatives, dead persons, as if they were alive and quarreled with her. So, there are three components especially. The first is desire for company. They want company. They are dependent, entirely dependent on their group, family, and must have support, and always likes to be with the people and who support her. The second component is she treats them outrageously. She wants company, but she treats them outrageously. She talks, shouts on them, and criticizes them. She hurts them. Then that is second part. Third part is quarrelsome. She quarrels with them when she discontented and she cannot keep quiet. She has to quarrel. Even she is a very good patient to the doctor, and she is very prompt regularly. If the doctor says particular time you have to come, so and so date you come, after 1 month, she comes exactly after 1 month. She follows everything very meticulously, and after some time she treats the doctor as her own family member, and she try to find out what doctor likes. If she doctor, by chance she says, I like pickles very much, and she carries pickles, and as a, you use this doctor, I made this pickle in my house with my own hands, because since you like it, so I made it for you. So as if she made for her son or her father or for her husband, her family member, she makes a pickle, when they like it. So like that she presents. So that is why, see, I am very careful with whenever some these Kalikar patients, when they inquire with me what I like, then I share, I don't like anything. I want my patients should be healthy. My patients should be, recover very fast. That's what I like. I'm not much bothered about food and other. No, 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 doctor. Tell me, doctor. Please, doctor. They'll be requesting. So I am very careful. I don't want to entertain, because once if I tell what these Kalikar people they are doing, I'll accept whatever they give it. She starts treating me as her family member. What she does with her family member, she quarrels. So she quarrels. Once what happened, I went to attend my sister's son's marriage in Hyderabad. I was not there for just 4 days, because the arrangements and all those things, my sister whom I brought up, so her children also, we are very much caring, my sister's families also. So myself and my wife, we went a little early to look after all the arrangements. So I was absent, my forum members are taking care. This Kalikar lady, she came. She was disappointed when she did not find me there, and she called me. What, doctor, you are missing? You are not at all there. I came to see you. You see, no, you cannot neglect me like this. See, if without informing, if you go like that, what am I to do? I came all the way like that. In the phone itself, she started bombarding me. And after that, okay, okay, I'm returning, you come, and so on. So she came promptly to see me. Then, see, how can you miss from the dispensary? See, how much problem I am, when you are not there on that day, night, I develop a lot of problem. This is another problem with Kalikar people. When they don't find the doctor, they develop a lot of anxiety, and they develop sickness. When they once another Kalikar patient, doctor, no use, doctor, this medicine has not helped me. Oh, it has not helped you. Okay, last time you told that you are unable to eat dosa and you are getting a lot of bloating. No, 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 that problem is solved, no problem. Now I am able to dosa. I am not only one dosa, I am able to eat two dosa. I am eating. Then last time you told some back pain you got. No, that problem is not that all those things, no problem. You see that also. Then there will be some 5-6 problems will be there, one by one. And no, those problems. You see, I have got you know. I'm severe sleeplessness now. For last 2 days I'm having sleeplessness. All that problems those are all resolved. See, she says one side that problem she is not better, medicine has not worked. But when I cross check everything, she is much better with the medicine. But since some anxiety was there because of her son or daughter did something, and because of that anxiety, she developed sleeplessness, and she says medicine is not working. This is the character of Kalikar people. They are quarrelsome with their doctors, but at the same time, they don't leave the doctor. They will bring some more patients. They bring the patients. They will certify to the others. No, he is very good doctor. Kindly come. I will take you. My doctor is very good. Like that, they will take more patients, and especially people who are having commercial practice. That is with fees who are charging for them. Kalikar people are very good patients. So if they develop a good approach with the Kalikar people, they will bring lot of patients. Okay. So there are different rubrics are there. So their desire for company and are their problems aggravated when they are alone. Desire for they treat the family members outrageously. Then discontent for everything. Even doctor they will treat outrageously when the doctor becomes very close. So I don't try to become very close to, especially Kalikar people. Okay, that is the thing. So anyhow, this is about Kalikar, very important remedy, and total constitution is covered. Now I will speak with this. I am closing Kalikar. Thank you, Pavani, once again, Krishna Pavani, once again, for your nice presentation. Then coming to our Homoeo Garu class, he did very well. He has, so many points he has covered. Only thing is, as some of the people pointed out, I asked our Homoeo Garu to take 2 classes. But he himself told, no, sir, it has come 1 class itself. So I too felt, sir, you have done little hurriedly, I felt. You should, this is an important subject. And I gave it to an important person. Homoeo Garu is a great person, very important person, and he is an intellectual. So I gave this subject to you to, anyhow, you once again, I will give you one more class. You can do it little leisurely. Anyhow, all our members got the concept of importance of modalities. See, here we want to make you to understand what is the importance of modalities. But entire subject of modalities we cannot cover. Okay. Here, for example, you see, Kalikar person is very chilly, and a fellow bending forward and getting relief. If you give Kalikar, that fellow is better with fresh air. Kalikar is a failure. Many of the homeopathy doctors, they have got their failures are because they have not understood the modalities properly, or they could not get proper information from the patients properly. Other day, in my native village, when I was attending to the patients, a few people have come. My friend has come from Visakhapatnam, Mr. Babu Rao, and my friend, another friend, Mr. Phanindra, who is now in Pune, his parents from Nellore, Sharma Garu and his parents, both have come from Nellore, and they are also there. That madam has nicely did dispensing work. Then he was there, and Satyamurthy Garu, a lecturer from Hyderabad, he came. Then Pidugurala, one gentleman has come, I forgot the name. Srinivas from Vijayawada, he has come. They are all attending our classes. So these people, while taking cases, I explained them. One patient, I asked, which weather you like? Immediately what she told, I like summer. She said, okay, very good, you like summer. Summer, there is no electricity. Electricity totally removed. Our chief minister told, nobody should have power. I only should have power. Except me, nobody should have power. I made a joke. So, no fan, no electricity. So, do you like summer? No, 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 I don't like summer. Then I don't like summer. I need AC. She said immediately, I need AC. She said. So, AC is not there. Then I cannot tolerate summer. This is the modality. Papa, what happens is unfortunately, this many homeopathy doctors come from the college, they will not get proper guidance. They start practicing. Then as soon as what weather you like, patient will tell, I like summer. Oh, like summer. Like that, they will write. There itself, totally case goes wrong. That patient actually likes winter season. Instead of winter season, she told summer. Because summer, she can stay in AC room, AC car, everywhere AC only. So, when we go in depth, similarly, some people tell, I like winter. So, I'll ask, okay, you like winter, there is no thick blanket, no sweater, only thin bed sheet is there. No, 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 I cannot bear cold weather. I want thick blanket, that woolen rug I need. I'll cover full, including my face. See, I tell, see, you like laddu. You said you like laddu. I'll give one laddu. So you should eat laddu, No, 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 don't keep, I don't keep the laddu away. Means what? You are not liking laddu. So you like cold weather. That means thin bed sheet you should cover up to here and you should enjoy the cool weather. But covering fully, you have put a protective wall around you. Security, jet plus security. It is like a minister telling, no, no, I am very bold. I can go to terrorist area. I can go to Naxalite area. Oh, it is nice, sir. You go, sir. All TV people. Then he has taken jet plus security and gone to Naxalite area, terrorist area. What we should understand, is he bold? Is he not afraid of terrorists? He is scared of terrorists. He has got multiple layers around him, security. So like this, here also, the thick blanket is a security, protecting from cold wind. So you should not write that person likes cold weather. Similarly, other person likes hot weather. These problems I could able to explain my team members. This is how case taking difficulties. And some more points also. When they are explaining some of the symptoms, their patients are explaining indifferently. Then I have given clarity. At that time, patient started explaining properly. So I explained these are the difficulties in case taking. Case taking is a great art. It is very difficult. You know very well which medicine for what. But patient should give proper information. Patient will not give because they don't know. It is the doctor's duty to collect the information properly. So for that, these modalities are very, very important. And similarly, another thing is understanding miasms and understanding nosodes. And other day, Dr. Shastri Garu so nicely about medorinum, he was explaining medorinum class. Unfortunately, our internet facility, our power supply, all these things, so many things, our class depends, so many factors. So suddenly it went off. So when he was talking, okay, anyhow, don't get disappointed. So we will take care. Our Shastri Garu will nicely explain in next Wednesday class. So it is a medorinum is a very important nosode, very important antipsychotic miasm. I use this medorinum extensively. I don't use thusia so much. I always prefer medorinum because I feel medorinum is more deep acting than thusia. Unless specifically thusia is indicated, all these psychotic, antipsychotic to use to counteract the psychotic miasm, I use medorinum. So medorinum is a wonderful remedy. So kindly listen to Dr. Shastri Garu next Wednesday. Thank you, Shastri Garu, for your wonderful lecture on medorinum. Then now it is 9:55. Similarly, I thank Homoeo Garu for your wonderful class. Next, I think you are already recording on miasms classes. So our Homoeo Garu will be talking on importance of miasms or the magic of miasms or importance of miasms title. He will make it and he will be talking. Then after I requested Shastri Garu, after listening to Homoeo Garu, to give his expert commentary. Like cricket, that commentator will be giving commentary, expert commentator will be giving that from the commentator box. Like that, our Shastri Garu, he is an expert. So I requested him to give his, whatever Shastri, our Homoeo Garu speaks, based on that further elaboration. Okay, he'll be talking. So you are most luckiest people. So I feel jealous about you because when I am learning, there were, for almost 10 years, nobody to teach me. After 10 years, my guru, Dr. G.V. Chalpati Garu and our Ranganath Rao Garu, who is our mentor, they are great people. So they are the people given so much knowledge to us and how we should acquire knowledge. That is the route they showed. Then afterwards, I started purchasing books, started reading on great doctors that George Vitolka sir, then Catherine Coulter, then afterwards this Rajan Shankaran sir's like books, and so many other people, Philip Bailey. All these people, they have given great knowledge. So my pranams to all those masters who have given such a great knowledge. Okay. So now we are able to share that knowledge to you in simple words, simple language. Other day in my Veeravalli dispensary, my native village dispensary, one gentleman who has come from a village from Machilipatnam, Bantumelli or somewhere, he is a veterinary assistant. He was telling, sir, your English is so simple. We are able to follow your English. Not only that gentleman, many people have told me, your English is so simple because I don't know high level English. I know only simple English. Even with my directors, with anybody, I talk only simple English with clarity. I always want to talk because when I was in NCC, there was a Major S.P. Rao was there. He told me one rule: you should talk anything with clarity. Every word should be understood properly. Your command, whatever command you are giving, it should be understood by everybody. Nobody should misunderstand your command. That is the important rule in military. That's what he told. That particular advice I liked very much. Since then, whatever I talk with clarity, and I will make it very simple. Okay. Thank you for your many people have complimented my talk. So I thank all of them. Yeah. In another 10 minutes I'll speak, because I have got the disease of taking little more time than I'm supposed to take. Okay, that is a bad habit, but transferring the knowledge, but I don't think it is, I need not feel bad about it. In my native village dispensary, I want to share little or my experience. So first of all, going here to there, we had hectic on the day. Saturday morning, I got up at 3 o'clock and made that day's video ready with that Ravi Shankar and our other lady Sharda's videos together, mixing, and one more video with my comments, everything. I made it ready, and after that I got ready, went to the dispensary. From the dispensary, I left dispensary, almost at about 12:45, I think, and reached my train Yeshwantpur. Train starts at 2:20. I entered train at 2 after 2 o'clock, 11 minutes. That means 9 minutes early I entered into the train. Then I got down in the morning 5 o'clock in Vijayawada, went to my village. Then I started the dispensary at 8 o'clock. By that time, 30 people are waiting. Then issued the tokens. By 9 o'clock, all the tokens are exhausted. 85 tokens we issued, exhausted. And many new people have come, and many old people also. After that, many people, especially new patients, I have to send them back. Long-standing new patients with chronic health problems, I have requested them to come back early. People who have come from far off, such people only I told to stay. Otherwise, close by people, I asked them to come next day. Like that, total 3 days, almost about 300 patients. Out of that, 35% are new patients. I attended, and many people have come and did service, even from this place, Prakasham district. What is that name? I forgot the age. One veterinary doctor, Kranti Kiran, Mr. Kranti Kiran, Dr. Kranti Kiran, he also came on third day. He also has helped. So totally morning, second day and third day, morning 5 o'clock to first day, morning 8 o'clock to night 8:30, we worked. Second day, morning 5 o'clock to night 8:30, we worked. Third day, morning 5 o'clock to night 7:30, we worked. 7:30, we closed. Then again immediately we have to rush to the Vijayawada. There I have to get down in Vijayawada to my relative. After taking 2 COVID injections, vaccines, he became very sick. I was treating him on phone only. Then I got down, took some medicines, gave to him, saw him, gave some medicine, created some sense of confidence. He is 89 years age. His age is 89 years. He felt so happy that I have given, I personally came, went to him and met him and gave medicines. By seeing him, me itself, he got a lot of energy. Okay. Then night at 10:30, I requested my cousin to come and pick me from there to railway station, and Mr. Vijayanand, who worked as a I think she chief manager or something in Indian Bank, and he took voluntary retirement. He worked he was deputed to CBI in to guide them economic offense cases. So such a person, I asked him to pick me, and he picked me and dropped me at railway station, and I could catch the train night 10:30, 10:50 was my train. That is the hectic schedule. Next day I came again. I reached home at 1 o'clock, got ready, had my food. Then immediately I rushed to our dispensary to attend the patients, to start at 2:30. That is the hectic schedule. Okay. Coming to patients, there patients, I have attended one girl, this veterinary doctor I told, that Prakasam district, he has referred that patient. She was brought in March, last March. She was brought, that is the last, before lockdown, I attended. So that girl, 9 years age, she was, her, she tries to talk, but she cannot speak. Her, what she is talking, she murmurs, but her talk cannot be understood. So she came, she was brought on 29/3/2021 to our dispensary at Veeravalli, and after seeing her, she want to interact with everybody. She want to talk to everybody. She want to be friendly with everybody. What is the constitution? Tell me. You put a message. What is the constitution? She want to be friendly. She want to interact with everybody. So from her seeing her, we understood as phosphorus personality. Her personality is phosphorus. She want to be very friendly. She is wishing everybody, and she was trying to interact with everybody. Though she was unable to communicate, but she want to interact with me, very friendly, as if she knows me since long time. So what are the medicines I gave her? And she was not at all sleeping during night, very less sleep. So that is the problem. So tuberculinum 1M, other day Shastri Garu are covered tuberculinum. So not developed properly, underdeveloped children. So development is not proper here. So tuberculinum 1M, 1 dose on 30th March, and Ignatia 1M, 1 dose on 20th April, Staphysagria 1M, 1 dose on 10th May. Then Syphilinum 1M, 30th May. Phosphorus 30, once in 4 days, after every 4th day. So in between 3 days gap. That 3 days, what I have given, you imagine what I would have given for her body development, mental development, apart from phosphorus as constitutional remedy, what I must have given to improve our growth hormones. What are the remedies? Pituitary 6 morning, thyroidnum 6 in the evening, phosphorus 30 in the once in for 1 day, phosphorus 30, 3 days pituitary 6 and thyroidum 6 in the evening, morning and evening. And she was brought on Monday, 26th July. She was brought, and she started talking. Now we can understand, not fully but partially we can understand. She started talking, her facial look has improved a lot, and she is sleeping night very well, no sleep disturbance. So sleep problem is resolved. Her look, there is a growth in her, good look has come, facial look has improved, and she is very cheerful, and she is trying to interact with everybody, she is talking everybody, she is wishing everybody. So that's a wonderful improvement. So parents are very happy with this case. So another case I will tell you. See, don't you think that our forum has done something great to this girl? So maybe after 1 year treatment, she will be fully all right, and she looks very attractive, very cute. She will be a competitor for our anchor Suma, because with our treatment, this hormonal and her constitutional treatment, totally her beauty, her look will improve a lot. So all anchors should be afraid of this girl. So I'm making a joke. Okay. Anyhow, Suma madam, don't worry. You have got your own this thing. Nobody will compete you. Okay. Then coming to another case, 55 years old gentleman has come to our forum at Veeravalli in March. So that gentleman has got psoriasis for more than 10 years, maybe 12 years. He has got psoriasis on legs and hands, and with severe itching at night. As soon as he goes to bed, he has to go on scratching, and he feels comfortable by going and putting his legs and hands under tap water, that a bucket of water, go on putting, and he puts a wet cloth, wraps wet cloth his hands and legs. He feels comfortable. That means itching is relieved, itching from the heat of the bed, but relieved by cold application. That is, what is the remedy? Main remedy, what I treat is alumina. Alumina is the remedy. But his constitution is Pulsatilla. He is a very good personality. He looks very nice also. They look, Pulsatilla people, they look very attractive, you know. He looks very handsome. So, and very friendly, very talkative with everybody. He interacts very nicely. He doesn't, try to have quarrels with others. So he's a personality. He likes cool condition, cool comfort, all those things. So though Pulsatilla also gives comfort, this itching problem, but Pulsatilla itching may not be so much horrible. Here itching is much more. So what I have given, Pulsatilla 30 in the morning, alumina 30 in the evening. These are the two medicines regularly for 2 months. Then tuberculinum 1 m 1 dose, ignatia 1 m 1 dose. Then because he is a heart patient, he wants cool condition, open air comfortable, cool condition comfortable. So it is tuberculinum, anti-miasmatic. So tuberculinum cases, chronic skin cases, skin problems. Tuberculinum is a wonderful anti-miasmatic remedy. Tuberculinum 1 m, ignatia 1 m, Staphylococcus 1 m, and this Pulsatilla in the morning, alumina in the evening. He has come other day. 50% of his problem, psoriasis problem, got resolved. And now he doesn't have much itching. Itching is almost 90% got cured. Then his skin eruptions, all that skin scales, more than 50% got resolved. He is very, very happy person. So, okay, that is another case. Then another case, one 20 years young girl has come, same March only. Then I also gave her 2 months remedy. So she also got psoriasis problem for last 5 years. Her these joints, these elbows, then knees, and around the knees she has got severe itching, and thick layers have formed. Then what are the medicine? She is better by hot application. Hot application is comfortable, warm application is comfortable, and thick layers have formed. And our problem is worse during winter and rainy seasons. So when I have taken her constitution, she is very friendly, very talkative, and she has got number of friends. She interacts very nicely. She, lot of artistic interests, making some art, singing, and performing on the stage. All these things have got, but at the same time, she is very chilly. She want to cover with a thick rug fully, including her face. She want to cover, and she cannot bear cold weather. And moreover, she was a shy-natured person. Initially, she was shy-natured, timid, but at the same time very friendly. With known people, she interacts very nicely, very talkative. No vasaposina pitta, Telugu. That means vasambu, vasa. There is one, this thing is there. If you put it, they'll be gone talking, like that. They'll be gone talking. She is a talkative person, very friendly, lot of friends. Then she is at the same time she is scared or feels shy. Instead of scared, shy to interact with new people. So what is her nature? Tell me our constitution. You put a message here. What is the constitution? It comes. One side is phosphorus has come. Another side is berita has come. So berita and phosphorus, berita phos. So I have given berita phos 30 morning, and this petroleum 30 in the evening. Petroleum is an excellent remedy. That thick, the psoriasis problem, thick layer formation, and worse, in a rainy condition and winter season condition. So berita, basilinum 1 dose, ignatia 1 dose. Then because she is a chilly person, basilinum 1. Very good remedy. Basilinum works anti-miasmatic, it works very well. So 1 dose basilinum, ignatia and staphylococcus 20 days gap. Berita phos 30 morning, petroleum 30 evening. You are given. Then she too got about 60% relief of her problem. She is very happy. Okay, such a wonderful results. And there in 3 days, whatever old cases have come, out of that only about 9 cases reported, there is no improvement, absolutely no improvement. All other cases, there is a lot of improvement. Then there, that cases, why there is no improvement, the reporting of modalities, some of the symptoms they have reported wrongly. So when I have retaken that cases, the whatever reported earlier, in spite of I tried to take my best, but still they could not provide. They are confused. So now they came with proper information. After verifying the information, now I changed the remedies. For example, one case, person told as bryonia symptoms, whereas it is not bryonia, it is Rustock symptoms. Okay, like that, the modalities are most important. Homoeopathy class is most important. Okay, like that, failures will take place. Okay, here also 9 cases, absolutely no improvement. That is my failure and patient's failure. Both the people are, we both are responsible. Not patient alone, not I alone. Both are responsible. Okay. With this, I thank all of you for today's attending today's class, and one by one I want to thank you. Shastri Garu, my thanks to you. Hanmay Garu, my thanks to you, my pranams, and Pavani, my blessings to you, and all the elders, my pranams to you, all the youngsters, my blessings. Thank you. Good night. Shubharatri.